The Veteran Lived Experience series features personal conversations with veterans who have agreed to share their story on topics prevalent in the veteran community. Veterans are joined in discussion by professional experts and members of the Veterans Health and Wellness Foundation team.
Good afternoon, everyone, and welcome to the Veteran Health and Wellness Foundation's Veterans Lived Experience Series event. As you know, we do this several times during the year on the second Tuesday of each month, starting at 1 o'clock and going to about 2 or 2:15. You can find the dates and times and specific months that we will be broadcasting these events. My name is Evelyn Lewis, and I am the president and chair of the foundation and your host for today's event. The Veteran Health and Wellness Foundation is a nonprofit 501c3 charitable entity, and we were established by military veterans who had expertise in the area where health, wellness, and healthcare delivery intersect with something we call social determinants of health and military culture. What we do as a foundation is embodied in our mission, which is to build, educate, and maintain resource networks to support the complex physical, social, and emotional needs of veterans in their communities across our nation. Our vision seeks to expand on communities that possess knowledge and capacity to not only identify and address service-related health challenges of our veterans, but also to embrace, support, and empower these veterans and their families who experience them. As we say often in the military, bottom line up top, for veterans and their families to be their best selves, the Veterans Health and Wellness Foundation strives to expand opportunities for them to live healthy and well lives that are undiminished by their service-related health concerns. With that, today's topic is about exoskeleton technology. This is a tool that is used to enhance natural abilities and improve one's quality of life. Since 2005, one of the companies in this space is Ekso Bionics. As a leading exoskeleton company, they offer technologies that have helped those with paralysis to stand up and walk, enhance worker capabilities globally, and provide research for the advancement of research and development projects that are intended to benefit United States defense capabilities. Today, we'll be talking about Ekso NR, a robotic exoskeleton specifically designed to be used in rehabilitation settings that progress neuro-rehab patients so that they can walk out of this device and back into their communities. As the first exoskeleton FDA cleared for acquired brain injury, stroke, multiple sclerosis, and spinal cord injury, Ekso NR offers the industry's most natural gait, reteaching the brain and muscles how to properly walk again. My guests today are Mr. Andy McGowan. He is a director of strategic accounts for Ekso Bionics. Ms. Elizabeth Cook, who is a DPT Ekso certified therapist and trainer, and Doug Eckhoff, who is a U.S. Army veteran. He will be sharing with us his experience and journey throughout the process that we're going to be discussing today. So I'm going to start with Mr. McGowan and ask if you could give us a bit more background on what this exoskeleton technology is, and in particular, the Ekso NR and its role it plays in helping veterans with some of the injuries we previously mentioned.
Sure. Thanks, Dr. Lewis. So happy to be here with you. The technology itself has been developed over the last 10 years, actually, by our company and other companies out in the industry. And the focus has been to provide basically a robotic suit to help patients, regain their ability to stand and walk. And so our exoskeleton and others on the market have been working at this problem, if you will, and bringing technology to rehabilitation space so that it facilitates the patient's recovery following the conditions and injuries that you mentioned. So, the EXO-NR is 10 years in development. We have put a lot of time and effort building the robotic suits to facilitate a therapist actually using it with a patient who's suffered paralysis, weakness, incoordination, and really helping support that patient's recovery as they go through through their time in rehab, whether it be in an inpatient setting or an outpatient setting. And I think one of the things that we've decided as a company to focus on has been using this technology, this platform, as a rehabilitation tool. And I think it's really important to set the expectation for people on the call that this is not, our technology is not designed to be a home exoskeleton or a home mobility tool. It's really only used in the rehabilitation setting by trained therapists like Elizabeth, who use it with various patients at various times in their recovery to actually provide extra support, like an extra set of hands, but actually helping teach the body and the brain to work better again and to try to restore the natural movements that people had prior to their injury, and hopefully can recover a great deal, in some cases, some pretty amazing results, and sometimes some longer term incremental progress, but providing that platform to help the therapist and the patients through that journey. The big picture is that people think of Iron Man type of suits. Let me just see if I could share this video, and I think this will explain what the technology is about. This is a stroke patient seen on inpatient rehabilitation at a center in New Jersey, but you can notice his left leg is extremely weak. He's at risk of falling because of the buckling knee and the weakness from that stroke. And this is the same patient in the exoskeleton device, supported by the unit, by the technology, taking very natural looking steps. And the therapist now is not concerned as much about the fall risk as they are about creating a good stepping pattern guided by the robot with the robotic hips and knees and the software control system that helps to create that pattern. This is immediately after, same session, same day, and the therapist is practicing with this patient for the carryover, we call it in rehab. So what is it like after you do something? What does it look like for a patient to then try to walk after they've used this type of technology? So I'll just pause for a second, let this play as a before and after. And Elizabeth, I would just go to you to see if you had any further comments in terms of what you see in this video with the therapist and the patient integrated with the technology.
Sure, I think it's important to discuss that carryover piece. And as you mentioned, that this device isn't something that goes home with patients. Our goal is to always get them out of Ekso and tell them, just think about all those cues we were just giving you in the device, and let's see if you can carry that over and walk regularly over ground without the exoskeleton around them. And in that video, you could see that he was able to take bigger steps and had more control. And so over time, hopefully, the brain makes those changes and doesn't need the exoskeleton around him to start with, and then he can go home with less assistance.
Yeah, I think that's a really important distinction. So again, the goal is to get patients walking better, improving their mobility, improving their access to everyday life services, whether it be a patient who might be walking short distances at home, but can't walk in the community. And being able to use this type of technology to help support that patient, as well as somebody who is just a few days or weeks after, a catastrophic stroke or a spinal cord injury, we can treat those patients as different as they are in the weaknesses that they have, types of impairments that they have. Ekso can be tailored and customized to match that person and also challenge that person as they go through the journey of using the technology. So It can be used at almost any point in time as long as the patient is medically cleared to be on their feet for as little as 15 minutes. They don't need to be able to walk necessarily to qualify to be in the device. And I think that's really important for early mobility and early recovery. We all know as time goes on, the chances of improving someone's, physical capabilities can be challenging, and sometimes it's looked at as there isn't really any hope. But what we found with the technology and through the research is that patients actually still have that capability to recover following their injury, following a stroke, following a brain injury, et cetera.
Well, thank you very much for that overview, and especially for that video. I think it was very telling about just how much that exoskeleton can facilitate one learning to walk again. Right now, I wanted to go to Doug to ask if he could share an overview, if you would, of what injury you actually had and sort of a bit about your journey using the Ekso NR to get back to where you are right now.
Thanks, Dr. Lewis. I'm Doug Eckhoff. I served 3 years active Army, 17 years with the Minnesota Air National Guard, and I got hurt 7 years ago in a motorcycle accident where I shattered my T12 vertebrae. I was out in South Dakota and I got transferred to the Minneapolis VA where they had the exoskeleton. And when I first started using it, I was not able or kind of afraid to walk because it was such a shock to my system, I guess you could say, that I couldn't walk after my accident. And using the exoskeleton, I eventually learned to walk with it. It started out, the machine did the walking for me so I could get the right gait, the right steps, and the right feeling in my body. And by the end of it, I was using it as a guide just to stay within the parameters, but building strength within my legs at that point. I was using it for a couple of months back then. And once I got discharged from the hospital, I was at my sister's, who was an hour and a half away. We used to drive 3 times a week to go in and to the VA system to use it. They were telling me that if I didn't use this system, or if it wasn't available, it would have taken me at least twice as long to learn to walk again. And I was glad I was able to walk. Now I walk with just a cane for balance in situations. But I'm so grateful for it because I learned to walk again. It was a scary situation at first, but with Elizabeth's help, we worked with it and got it going. I think that's all. Is there anything else you'd like to know, or?
Well, we'll probably have some questions in and out as we go here, but I wanted to see, since you did work with Elizabeth, what her comments would be specifically to her working with you, and then to talk with us about whether or not that's sort of typical experience that a patient will have, or is every patient actually very, very different?
Sure. And I think Doug forgot to mention that I had to put him on a diet in order for him to get in the device when he was first an inpatient. I think he ate too many ice cream cups. But there is the capacity for Ekso is 220 pounds. And so we needed to make sure that he was able to get in it, especially with the weight of the TLSO. So he did have to wear a brace around his back at the beginning too. So I just wanted to mention that even if someone is newly injured and they need to wear a brace, a TLSO, they're able, or a cervical collar, as long as they're cleared by their physician, they are able to get into Ekso. And yes, as Doug mentioned, he was hesitant to start walking again. He didn't fully trust his legs as the strength was coming back. So Ekso was kind of the jump start he needed to learn how to walk. And then, as he mentioned, once he learned how to walk again and started trusting his body, we really used Ekso as an exercise tool to get a large number of steps in each session. And a lot of research in physical therapy and returning to walking after a neurodiagnosis focuses on high intensity. So getting that heart rate up and getting a lot of steps in a session. And so Ekso really allowed us to do that and gave Doug the confidence to walk without Ekso on. And it really improved his balance. And that's something that as therapists, we look at in engaging the core and the trunk. And Ekso, because he was walking with a cane also, he had to work on his balance during that stepping pattern. And so he was able to then transition to walking with a cane without Ekso, and then sometimes even walks without an assistive device, like if he short distances within his home. So it was exciting to see his progress through the inpatient and outpatient recovery. And to answer your question about, is this typical? It depends. So with all neurodiagnoses, everyone presents slightly different. And Doug's, with his spinal cord injury and being an incomplete injury, he was able to, I would say, get a significant amount of motor recovery within those 3 to 6 months post-injury. Some people, it takes a little bit longer. And then with patients that have a brain injury or a stroke, sometimes they have quicker recovery, as the brain has been shown to be more plastic and kind of adapt and relearn quicker than, say, the spinal cord injury, the spinal cord that's damaged. And then we also have used Ekso for patients, say, with MS or Guillain-Barré syndrome. And with Guillain-Barré, we've noticed that putting them in Ekso again reminds them how to walk and relearn and know when to activate certain muscle groups. And so in clinical experience, my personal experience with patients with Guillain-Barré, they tend to have the quickest recovery and bounce back after putting them in Ekso, and their body really responds to it. And then they're able, hopefully, to return to walking over ground as they normally would.
Have you ever seen, in terms of working with someone like Doug or the other patients that you were just talking about, where their progress, seems to be moving forward, and they seem to be doing well, but then they have a setback of sorts? Is there a reason for those kinds of things? And then are they put back in the exoskeleton for a period of time?
Sure. I mean, with every recovery process, there could be some setbacks or even a plateau in recovery. So as we do traditional physical therapy, so to say, if we're not making the gains that we want, we might try to throw something else at the body to see if it responds in a different way. And we can use Ekso for that. If they say didn't meet the criteria to get an Ekso, say they were overweight or have some other like non-weight bearing of their upper extremities, if they had an additional fracture during an injury. So sometimes we're not able to put them in right away, but then as they get cleared and get medical clearance, then maybe we're able to use this intervention. And it's another tool in the toolbox, I like to say. As physical therapists, we have many different things we can do with our patients to try to promote that recovery. So it's a matter of finding the right tool at the right time. And oftentimes Ekso is a good starting place, but also can I like to use the word jumpstart. It really just jumpstarts someone, whether they're in a plateau and needs to remind their body again, or early on in their recovery. It's a good tool for that. Great,
thank you. So this, as you mentioned, this is another tool in the toolbox. And I guess the question would be, where is this additional tool? Is it at every facility that treats these types of patients with these types of injuries? Or is it at specific facilities? And do any of the VAs who treat patients with these types of injuries have the exoskeleton?
Yeah, Elizabeth, Elizabeth works at the Minneapolis VA. So they've had the technology for a number of years. And have a very robust program. It really is, at this point, it's a site-by-site decision, I guess, if you will, as to whether they bring the technology in. This robotic system it can be for some centers, it can be expensive to bring in. However, the results that the clinicians are seeing and the patients are seeing oftentimes helps build that story within the organization. And so my role as the director of strategic accounts in our company's goal is to expand the access to as many centers as we can that are seeing these patients in inpatient rehab or even outpatient centers. So there's a number of programs. The VA, we are on contract with the VA. So the VA does have the ability to acquire the technology. Many times, the VAs have very different programs site to site as far as how they do rehab. To Elizabeth's point, there's a lot of tools that they can access. So we're constantly looking to expand our footprint within the VA, as well as wherever else patients are being seen for rehabilitation following these conditions and injuries. I'll just highlight a couple of centers that in the VA network that, really have developed some really good programs. Some of the centers have had difficulty with the COVID crisis, obviously, not being able to, share equipment sometimes. And Ekso is a one size fits most patients, right? So it can be used with multiple patients in the rehab center in the course of a day, a week, a month. There's been a lot of impact from the COVID crisis that has, reduced that capability of many centers. But I'll give you an example. The Tampa VA, the James Haley Veteran Center, has a very robust robotics program that has exoskeleton clinic. The Bronx VA, James Peters VA Medical Center in the Bronx, has had very robust research into exoskeleton technology, has a clinical component to their program. Hunter Holmes in Richmond, Virginia is another research site. The VA has been at the forefront of bringing this technology to the industry, to the rehabilitation industry. With the research that they've done at these centers, it has really built the story as to where these devices are efficacious and can be used to really drive the recovery process for their patients. So those are some of the highlighted sites that I think that we know that are doing really great work and have access. But it is at this point still an evolving technology. It's still early in the adoption by the rehab centers. There's about 1,300 rehabilitation inpatient centers in North America, and all the robotic exoskeletons, it's in about 15% of those centers. So, and that doesn't include the VAs, but just to give you a sense of, this is disruptive technology. It's very different from the way therapists will traditionally treat their patients manually or conventionally. So, we're on that adoption curve in the early phase of some really advanced technology, but we're super excited about the possibilities that we can bring to the rehab space.
Okay, you mentioned that this tool was in some of the VA facilities, and as we know, for any number of reasons, there are some veterans who get their care there or don't. If they don't have coverage or being seen at a VA, how do they pay for this rehab or PT using the exoskeleton if they're not in that VA healthcare system?
Sure. Elizabeth, would you just speak to how it works within the VA system, and then I can take it outside of the VA?
Yeah, so if a patient is being seen at the VA for whatever reason, and they feel like they want to try an exoskeleton, such as Ekso, but there's not one at their local VA, they can ask about a community care consult to see if they can go to essentially a private sector facility that has one on an outpatient basis, and see if the VA will cover a few of those visits. And then usually that's the process. Or if they live within driving distance of a VA that has one, they can ask, their primary care physician or the doctors that they follow to put in a physical therapy consult.
So it's really the consult to PT that will enable them to access that tool.
Yes.
Okay. And Andy, you were going to say something else about systems outside of the VA?
Sure. So, whatever setting the patient might be in, whether it be in an inpatient rehab center or an outpatient, there's no additional cost to the patient for the use of the technology, right? So as they are admitted to an inpatient center, their insurance, Medicare, pays for that time in that facility. Whether or not the patient receives Ekso or not, there isn't any additional cost, associated with it to the patient. So if the therapist picks that tool off the shelf and says, yeah, I think, Mr. Smith, you would benefit from this, and they start using it in the inpatient center, there isn't any additional cost to the patient. It's covered under the reimbursement that Medicare and other insurance companies provide, including, TRICARE, or even potentially, the other VA healthcare. So on the outpatient side, it's a very similar story. Reimbursement is a little harder in the outpatient world and private insurance. There's limitations, but there isn't any additional cost to the patient for using the technology.
Okay, thank you. Elizabeth, I wanted to just go back to you for a few minutes. When you were talking about working with Doug and his injury, you mentioned that you put him on a diet prior to starting him in the exoskeleton. So I have a couple of questions around that. One is, how close after the injury does one have to get into physical therapy for this tool to be effective?
They can get into it right after injury as long as they are cleared by their physician. And for Doug, it was just a matter of like 8 pounds. So I just told him to eat some chicken and vegetables for a little while, and that's all he needed to do. But for people that with any diagnosis, really, it's just as long as they're cleared by a physician. There are places around the country that use this in the acute phase right away in the hospital, getting people up and walking that even don't have neurodiagnoses, that are just maybe deconditioned. So it really, all the research points to, as soon as you can get someone up and mobilized, they have better outcomes. And so as long as they're safe and the therapist feels comfortable and they have clearance by the physician, then the earlier the better.
Yeah, one of the reasons I asked that was because suppose there's a veteran who's had one of these injuries that we've talked about, an acquired brain injury, for instance, and they don't know about this technology, which is one of the reasons why we are talking about it today. And so through this mechanism or some other, they happen to find out that this exists and that it could potentially benefit them. And so they, go through the appropriate channels of asking their physician or in their VA or what have you. And they get to a point where, yes, this technology is available to them or they can access it, but now they're, several months,
Sure.
4, 5, 6 months down the line. Can they still benefit from this technology?
Yes, absolutely. So there's research, of course, on the acute phase, but also chronic phase of recovery. And so we even here see many people outpatient basis that have chronic SCI, so greater than a year post, that are still able to make some changes to their body. And then especially post-stroke, I know that there's some research, and I'll just mention that on the Ekso Bionics website, there's a research tab that anyone can look up the research that has been completed, but there is a study that compared chronic stroke. So someone that's been a stroke greater than a year, they were still able to make changes to their body. And again, as I mentioned, Ekso is just a tool to get someone up and moving. And once our bodies are in that upright position, there's a lot of things that just naturally occur just in how we were made, with, you know, getting our feet planted on the ground and taking a stepping pattern that triggers some reflexes and just some autonomic things in our brain that help us remember how to step and use the muscles in the correct way. So really, at any stage of the game, people can benefit from this technology.
Now, well, part B of my question around weight and the time out that this tool is useful is because we often see where people who've had a stroke or some type of injury that renders them immobile in terms of walking do gain weight. And so with that process in place and the limitation of the exoskeleton in terms of that, are there any plans to increase the size or weight that one can fit an exoskeleton, or would anyone who is outside of that range have to meet those requirements beforehand?
Yeah, it's a great question. It's probably the number one question we get. And I would say, yes, we are acutely aware of the weight limitations. When we got our FDA approval, it was really what we submitted for data that the FDA made that determination. So we don't have necessarily a device limitation itself, meaning we could handle more capacity, but right now our limitation is dictated by the FDA. There is a little wiggle room there, but we do have plans on the developing technologies, you know, blackboard, whiteboard to improve that capacity. So that is coming. I don't have a date in the future as to when it's going to be available commercially, but it'll be in the marketplace probably sooner than later. So I think it's also important just to kind of highlight that there are so many patients out there that, you know, to your point, don't know about it, and sometimes the therapists or the physicians or people don't think about what other things could we do or should we do. And I think it's really important to encourage people to continue to look for opportunities and different types of treatments that could benefit them, and to ask providers about it. You know, I think in many cases people are told certain things at certain points in their recovery, and that's kind of the final word in the journey. And I do think that there's lots of research evolving that is showing the ability of the brain and the body to relearn these movement patterns and to improve patients' function. So don't stop looking, don't stop trying to get better. And I think that's the message, you know, that we try to preach. The hope part of, you know, what people experience using this type of technology, I think, is almost as important as the physical training aspect that they receive.
Okay, and going back to you, Doug, as well as Elizabeth, what have you seen this technology do for the families of the veteran who is receiving this type of care? I'm sure the impact of the injury, the initial injury itself, which rendered them unable to walk, was quite a jar to that family. What would you say is the reaction that you've seen from families as you see these veterans in these recovery phase, in the different levels of the recovery phase?
I guess from my perspective, in my family, they for sure thought I was never going to walk again when I first was in the accident, and they came and saw me laying in the bed there. But then watching me do all the different things I had to do to walk again and using the exoskeleton. My sister went to all my therapy sessions when I was living with her, and she was just amazed at what I could do, that I could actually get up and walk and move around. And I mean, there was days that we would be back at the house talking and she would cry because she didn't think I'd ever walk again. And it makes a big effect on the family. I mean, my parents saw me do that, and they saw me walk, and they came to the hospital and watched my sessions. And it's a big boost for somebody to see somebody walk again. So.
And I just want to add on to that. And I think, you know, we don't make any promises in anything that we do in physical therapy, whether we're using Ekso or any other intervention. We are always just here to push the limit and see what our patients can get back, but just offer them a little bit of hope. And if this just gives them a little bit more function to make, you know, sometimes we don't get the results that we want. Not everyone is able to recover, such as Doug was able to, just due to the nature of their spinal cord injury or the severity of their stroke or brain injury. But we always try. And even if getting them an Ekso and they're able to get a little bit stronger in their core to help with transfers, or in Doug's case, get back to overground walking and even to do stairs, so they're able to not only get into their home, maybe that has a ramp or accessible, but then they're able to go visit their family that maybe has a couple steps to enter their home or a whole flight of steps, and just by getting them stronger in their legs. And so I do think it has a significant role to everyone that's involved in these patients' lives and these veterans' lives, so that they're able to participate out in the community more and just have a better quality of life. Even if it just helps them 10% get a little bit more strength back, then it was worth it.
Yeah, and so I could only imagine, Doug, as you were talking about your sister and her seeing the progress that you've made. When we often talk about physical therapy or rehab, you typically come in, you have someone like yourself, Elizabeth, helping you go through and use various tools, but there's often homework that needs to be done when you get home. Is there homework that a veteran needs to do when they get home? And what is that, and how does that work in terms of the veteran themselves and or assistance from family members?
In my case, they gave me a list of different exercises to do, you know, sitting in a chair and getting up with the help of the arms of the chair, do that 20 times a day. Doing some planks on the floor to help build my core up, my leg strength. I mean, that's what helped me. I do a lot of it too, so.
Yeah, so we definitely use our time in therapy with, say, a skilled physical therapist and the use of technology. We want to use all of that during our time when the veteran is with us. And then we do send them home with what we call home exercise program. So based on what we're seeing in the clinic and what we feel like they still need to work on, give them specific exercises that they can do on their own at home. We definitely try to get it so that they're independent with these exercises, so they're not needing additional assistance, but sometimes they do need help to, say, do a few of the exercises or to get on the floor and get back up again so that they can complete them. But yes, we always are wanting them to work on things outside of the clinic. Doug was able to come 3 times a week for an hour. Sometimes our veterans are only able to come once a week for an hour. So we really want them to be taking what they're learning in therapy and doing it at home when they're not able to come to the clinic.
Yeah, is there a minimum or maximum number of sessions that you found more beneficial than others in terms of how many times a week they're actually available for the therapy?
Yeah, that's a great question. And I think as therapists, we're always looking for that magic potion or that magic protocol that if they come 3 times a week for 8 weeks, then we're going to see these results. And unfortunately, it doesn't tend to work that way. And we, again, as much as our patients are able to come for outpatient therapy, in our availability 3 times a week is awesome. That's not realistic for a lot of people. So even 1 to 2 times a week for however we deem necessary. And so the beauty of the VA is that as long as they're making progress and continue to show gains, we're able to justify keeping them in therapy. So it's different for everyone. Some people are able to make really quick recovery and they are only coming 1 time a week and that's what they need. Other times they're for 3 times a week for 6 months. So it's very dependent and there's no one size fits all with this, but we use our best clinical judgment to determine how often they should come in and what their availability is to progress them as much as we can.
Okay, well, thank you for that too. I think Andy has another video that he wants us to take a quick look at before we wrap this up. And so, Andy, if you could tee that up so that we can show.
Yeah, I just need a minute or two to find
Sure.
it, Doc. I just
No
searching
worries.
for it. So
No
yeah, give
worries.
me just a minute. I'll have it up in a second here.
Okay. Elizabeth, do you have any other, I guess, tidbits or pieces of advice for veterans who might benefit from this, who don't know that this device is available? How can the foundation be more helpful in terms of getting information to them? And is there anything in particular we would need to say to them to get this information out?
Yeah, I think for veterans that may have a neurodiagnosis, I think just asking the question to see if anyone has heard of it at their local VA and if there's a process to and seek out the information, because sometimes people won't know the answer, but then you might have to wait and just ask again and see if you can push it along that way. But I do think that it's worthwhile technology and has made a difference in a lot of our veterans here in Minneapolis. And so I would encourage people to just keep trying. And there's no specific process necessarily. Each VA has different funding and different ways that they go about getting equipment for clinics. And so it's just asking the right questions to the right people.
Okay, well, thank you. Doug, do you have anything else that you would want to share with other veterans who will listen to this once we post it on our site?
No, nothing special. I guess I just emphasize using the VA system. Like for me, it doesn't cost anything to do this. The seminars I did and the therapy I'd used, and it's well worth it to me to be part of that system. I know there's a lot of people that are out there that are not part of the veteran system at the VA, and I think they should get involved with it because it's a good system. I mean, you hear a lot of publicity about it not being good, but where I go, it's some of the greatest things I've ever had happen there. So,
well, thank you. We'll appreciate that. We share that that sentiment with our veterans also.
All right. So I think to your question earlier about how long can patients, how soon and potentially when could they benefit from this? This gentleman I met at a training actually in Berkshire, Massachusetts. He was a veteran being seen at an outpatient center that had a focus on spinal cord. And Terry was injured in Vietnam. And this is during the training when the folks on his right are the new therapists and our trainers working with Terry. He's been basically in the wheelchair for 12 years prior to this. And so this was his first day in the clinic being evaluated for the technology. And I won't show the whole video of him trying to take a few steps, but you can see how labored this is. And again, similar to the other video, the concern about his knee giving out on him as he's trying to take just a couple of steps. And he had been fundamentally in the wheelchair functionally. His wife couldn't leave him at home by himself because he couldn't get to the bathroom or he could not get up and take a few steps across the hall. So this was a real challenge for him to access the community. And he used the power wheelchair anytime he was, in his waking hours. 2 months into using Ekso 2 times a week, this is Terry walking in the device, facilitated by the therapist behind to actually, again, achieve those good quality stepping patterns and a lot more repetition. His posture, he's not bearing the weight through his hands and his arms like he was. And again, it's really just an indication of how smooth you can build the pattern with this technology to really help retrain the body and the brain. So Terry's really doing well here. He's cruising right along. And the therapist can change the settings on the fly so that if they want to challenge him more, they can. And I think that's a really important thing, that it becomes a very useful tool in the rehab setting. 2 months into it, this is his post-walk. This is immediately after this session that I just showed. And so he's now much more, call it independent, if you will. Still needs support, still needs to use the walker. But the therapist is less concerned now with Terry's right leg giving out on him, because he is getting return of that strength, that coordination. And finally, at 4 months after, this was his payback, which was he was able to independently walk with a rolling walker. His wife was able to, go out to the store, and Terry could ambulate in the house. And so his access to everyday activities was dramatically improved. He still used the powered wheelchair for community, community access. But these are the types of stories, I think, anecdotally, we see all the time. And I think over time, the research is going to continue to show the benefits for these patients, early and even late in their recovery.
Well, thank you for sharing that with us. That is really nothing short of amazing. It really does get back to that question I had about how far out can one benefit from this? When you look at someone who hasn't walked in 12 years, go from nothing to ambulating on their own with the use of just a walker, that's just, like I mentioned, nothing short of amazing. So thank you again for that, Andy. For those of you who have joined today, and for those who will view this later, we will have some additional resources available for your use. And if you have any questions, please contact the foundation. Just send emails out to info@myvhwf.org. Again, that's info@my, V as in Victor, HWF as in Foxtrot.org. And we will forward those questions to Andy and his team, get those responses and get that back to you. We'll also provide a list of some of the facilities out there who have these tools already in their toolbox, and some information on how you can contact them and others to find out more about this device if you're in need or someone in your family is in need of it. So with that, I would just like to thank Andy, Elizabeth, and Doug, who are our guests today. Doug in particular for sharing his story and his journey with use of this particular tool. And for all of those who've joined us live, and for those of you who will view this on the website or our YouTube channel later, those of us here at the Veterans Health and Wellness Foundation would like to wish all of our listeners, our guests in particular, supporters, a happy, healthy, and safe Thanksgiving. And we look forward to having you all join us for our next Veteran Health and Wellness Foundation event for the Veterans Live series, which will happen on December 13th, 1 o'clock. If you have any questions or comments about that, again, just direct them to info@myveteranhealthandwellnessfoundation.org. Thanks again, Andy, Elizabeth, and Doug. And we look forward to continuing this dialogue and keeping in touch so that we can make sure that veterans and their family members, friends, et cetera, have access to this information and knowledge of this tool so that it will benefit all of us, helping them, as you mentioned, step out of physical therapy and back into their communities. So thank you again for what you shared with us today.